Please turn off and put away all electronic devices. Concessions will be closing in 10 minutes. And now, your feature presentation. In the movie A Beautiful Mind, we follow a gentleman named John Nash from West Virginia, going to Princeton. It begins in 1947. John is a mathematical genius and graduated in 1950 with a doctorate in mathematics. Shortly afterwards, he begins teaching at Princeton. By 1953, he believes he starts work for the government decoding and spying on the Russians. By the 1970s, his symptoms of schizophrenia begin to subside. Today we meet John at the Harvard Mathematician Conference, where he is a guest speaker. John is stuttering during his speech and unable to focus. During the middle of his speech, he is met with psychiatrist Rosen and taken to MacArthur Hospital to deal with his delusions and is forced to confront what is real and what is not. He is diagnosed with schizophrenia. This is his story. Scene 1. Psychotic break.
Good afternoon, eager young minds. Today, we are going to talk about mathematics. And when talking about mathematics, it's always...
Professor Nash! Professor Nash, stop!
John, I'm Dr. Rosen. I'm a psychiatrist.
Forgive me if I don't believe you.
I'd like you to come with me, John, just for a chat.
Well, it seems that I have no choice. Get off of me! Get off of me! I know who you are! Charles! The Russians! Russian Charles! Do something! Call somebody! Quick! Call somebody!
Steady the leg!
Get off of me! Get her
Steady the leg!
Get her! Get her! Out of her!
Scene 2. MacArthur Psychiatric Hospital.
Go easy now. Thorazine takes a little while to wear off. Sorry about the restraints. You have one hell of a right hook.
Where am I?
MacArthur Psychiatric Hospital.
You have the wrong guy. My work is completely non-military.
Which work is that, John?
I don't know what you're talking about. I don't know anything.
There's no good in keeping secrets, you know.
Charles? Charles. I'm sorry, Charles. I didn't mean to bring you into this. Charles? The prodigal roommate revealed! You lying son of a bitch! You saw my name on that roster!
Who are you talking to? Tell me who you see.
How do you say Charles Herman in Russian?
There's no one there, John. There's no one there.
He's right there! He's right there! Stop! No! Ah! My name's Sean Nash! I'm being held against my will! No, please! My name's Sean Nash! I'm being held against my will! Please, somebody call the Department of Justice! I'm Sean Nash!
Scene 3. It's not real.
Code red! Dr. Rosen to 224! Code red!
What are you doing, John?
The transducer. It's gone.
John, it never was real.
It's there. Keep looking.
There was never anything there, John.
They're hiding it from you.
Scene 4. Assessment.
A Beautiful Mind mental health assessment. Purpose is to observe appearance and demeanor and asking about thoughts, moods, delusions, hallucinations, substance abuse, and potential for violence or suicide.
Hello, John. I'm Dr. Kane. This is Nurse Sam. We just want to ask you a few questions, and I'd like to start with knowing your name and date of birth.
All right. My name is John Nash. And I was born the 13th of June, 1928.
And so how old would that make you, John?
Well, if my calculations are correct, and believe me, my calculations are always correct, that would make me approximately 31.
All right. Do you have any allergies we should know of?
Not that I'm currently aware of, no.
Do you have any religious preference?
I believe in science, and I believe in theories, and I believe in things that are real.
Do you believe in God?
No.
All right, John, so where do you live currently?
I live in Princeton, New Jersey, and with my wife Alicia and our 2-month-old son, John.
And any other close relationships besides the two?
Well, I have my colleagues at school, but I only have one real close friend, and that's Charles.
All right, all right. How long have you known Charles?
About 5 years now. We were roommates in college.
And could you state for me where we are currently?
We're in the MacArthur Psychiatric Hospital, supposedly, but I find that highly unlikely.
John, that is correct. This is MacArthur Psychiatric Hospital, and I'm Dr. Kane, and this is Nurse Sam.
Well, pardon me if I do not indulge in your attempts to lure me into false sense of security, that I may give you information so that you can turn me over to the Russians.
John, we're just trying to make you understand that there's no one here to harm you. We just would like to ask you a few more questions, if that's okay.
I suppose I have no choice.
Has there been anything particularly stressful recently occurring in your life?
I could say having a baby, changing the history of mathematics, among other work, could possibly cause someone stress, yeah.
Oh, you're changing the history of mathematics. How are you going about doing that?
Well, I'm working on a theory right now. My work's very important to me.
I see. And where is it that you work again?
Well, I'm a professor at Princeton University. I'm teaching eager young minds about mathematics.
All right. And your other work, can you tell me a little bit more about that?
Well, I'm not supposed to, you see. It's highly top secret and very dangerous. If I was to divulge any information concerning my work about the military, I didn't tell him.
John, who are you talking to?
Charles. Although I don't see why they brought you here. Unless you've been helping them the whole time.
John, I don't see any Charles there, so who would he be helping?
You know very well who. Can't believe you'd do this to me. Thought you were my friend. You've been lying to me the whole time. You aren't even a friend at all.
John,
I've got to leave.
do you become angry often?
No, I don't believe so. I only become upset. People ask me questions about my work.
And what about sadness? Any problems with sadness?
I would not say sad as much as inability to not feel anything at all, really. Sometimes I feel dull, like I'm just a shell of a person. Sometimes I get upset when people try to threaten me or my family.
Now, who would be threatening your family, John?
Well, Parcher, sometimes, he will tell me to get rid of my family.
Now, who is Parcher?
He's my boss. Should I have told him that?
Do you ever consider hurting yourself or others, John?
No, I never hurt anyone. Can I go now, please?
Yes, John, yes. Let's get you some rest, okay? Let's go back to your room.
All right, Dr. Kane. So some of the stuff that I noticed with John today as far as behavioral was that he was doing a lot of nail biting. Wasn't really able to sit still, if you noticed. Lots of fidgeting. He had very rapid speech. He was talking pretty fast.
A little bit of stutter.
And he was repetitive with everything he was saying over and over. So very loud. But he did cooperate with everything that we were asking him. He wasn't saying that he didn't want to speak. Got a little bit guarded and defensive there, but was continuously scanning the environment, looking for Charles.
Yeah.
That was Charles, yeah. He seemed a little bit fearful about some maybe possible danger that he thought was gonna occur.
Right.
Let's see, what else do we have written down for Mr. John? He kept tending to think that someone was gonna get him out of here. I don't know if it was Charles or whoever he was getting the environment for. Okay, so basically our biggest concerns with John right now are his paranoia, his delusions, and his hallucinations.
Right.
I've got my nursing diagnosis here. It's social isolation related to inability to engage in satisfying personal relationships, secondaries to schizophrenia, as evidenced by a lack of eye contact, dull affect, withdrawal, and expressed feelings of difference from others. Our goal is to, patient will talk with at least 2 people at 2 different times for 1 hour a day, and 3 interventions. Number 1 is that we encourage the patient to increase the level of his social contact gradually, rationale being so that he doesn't feel too overwhelmed. Number 2 is to help the patient locate community resources and support groups, rationale being to decrease the isolation and provide support. And number 3 is to encourage the patient to articulate his feelings and listen non-judgmentally. And rationale being this is to know his ideas are valued, basically.
Right.
So.
And did you notice on his right forearm, there's a self-inflicted wound?
Yes. Yep. That was reported.
So we're getting that taken care of and cleaned and bandaged?
Yes, ma'am.
All right, well, with all this information that we've gone over and after talking with John, I think my medical diagnosis of his medication would be the loxapine. It's antipsychotic. There's minimal effects. Mostly the ones that his family's concerned with is decrease in libido, so that doesn't affect that. And also he wants to be a little more oriented with his cognitive abilities, so there's not as much sedation. We're going to start him at 10 milligrams twice daily. Over a 2-week span, we will increase gradually and get him to 100 milligrams.
Okay.
Good.
All right.
I think that does it.
Okay.
Thank you.
Thank you.